When we started the program 4 years ago, in communications and campaigns, we had 13 different databases, which all had email lists. Everybody was sending things out through Outlook. It was just all over the map. And that's on top of the email program that they had already started. So we literally had to, over probably a 2-year period, sit down with each of the individual teams and say, and explain why.
That looks
this isn't awkward at all. It's still not. Well, anyways, we literally had to sit down with everybody and say, you know, this is the reason that we need one database. This is the reason, you know, we're going to map out a plan. And, you know, it took a lot of buy-in from directors and above and saying, we really need this. And then filtering it through. And when you sit down and have a conversation one-on-one or one-on-two with people and you say, we really need one system, you're still going to be able to send out your messages, but they just need to be streamlined, and we're going to work with you. It was amazing to me, actually, how little resistance we actually had. Of course, we always had people that would, as we call it, go rogue and send things out without telling us, but the great thing was I was on basically all of the email lists, so I could pretty much go and call people out when they did it. To now, 4 years later, where we literally have 2 databases. One, we use Convio, and we also have Team Approach, but we have a data sync between the 2, so literally there really is only one. You know, we were talking about the 360 view. We finally, after 4 years, have that. But to be honest, there is a lot of hand-holding, and it takes a while to get people through it. But I think most people are interested in you know, being more effective, and if you can put it to them that way, I think you'll start to find that people start to come along with you.
Shall I have anything to add to that in terms of the work with your affiliates?
Well, I would just 2 things. I think we all have different constituents in this conversion, and our board, for instance, was completely easy to tell them about this transition. First of all, there are a lot of business people. They understood the issue of core competency. They also, from our own experience, knew that we could not keep pace with the changes of technology through proprietary software and technology. So it was, and you know, obviously also efficiency and cost savings. So that was quite easy. I think that the other group of stakeholders are our affiliates, and we have, as I said, about 250 affiliates. Many of the directors of those affiliates have been running them for 20 or 30 years, sometimes I think 40 years. And so they are not, many of them are, most all of them are not on Twitter. Most all of them are not on Facebook. They don't necessarily fully, you know, understand some of the changes that are transpiring. And so I think, you know, ironically, also they did embrace this when we sort of did an analysis and they could understand it from a, you know, just a presentation perspective. But I think the actual adoption of this does have to be both, you know, purposeful over some period of time and also with some degree of real effort around the training and the support systems that go along with it, because it will not necessarily be as easy, especially for those folks that are not, you know, early adopters of technology.
Real quick, I want to touch on something you said, and I think it's an important point, is that you're also thinking about these tools in the context of not just where they are right now, but also where they will be. And I don't care how big of a development team you have, you will not innovate as fast as Google, Salesforce, and Facebook. They are innovating, kind of having seen the evolution of the nonprofit-specific programs that each has, so the Google Apps for nonprofits, the YouTube for nonprofits, and Facebook Causes. Seeing just the short 18 months, in some cases, that they've been around, how fast they've changed, and the number of new resources and tools that they've made available to nonprofits in that short period of time. There's no nonprofit out there that their development team, with their own proprietary system, can keep pace with that. So I think it's a really important point that you're making, is that to keep pace even, it's almost important to be integrating these tools and to be really on board with them, because they're gonna if they're not there now, they probably will be soon, and I think we've seen that time again.
That's a great point. Judy, let's turn to you to talk about the Colorectal Cancer Coalition, because you're a younger, smaller, newer organization, and can you tell us a little bit more about your organization, what it's trying to do, and then how you're using these tools in your context?
I was really comforted in seeing Atlas Corps because we're about a similar sized organization. C3 started in the middle of 2005. As you said, I came out of the Colon Cancer Alliance, which is more of a patient support, general public awareness of colorectal cancer, which is the #2 cause of cancer death of men and women in the United States. And it's the disease no one wants to talk about. In other crowds, we usually lead them in a rousing cheer of rectal, rectal, rectal to get people to talk about it. I'll spare you.
Well, wait a minute. We can do that.
Okay. 1, 2, 3. Yeah. Well, actually, right. So C3 started from those of us who had met through other awareness colon cancer initiatives. As you said, I lost my father almost exactly 10 years ago to colon cancer, and that's when I started getting involved. I was an accidental techie. I was online anyway and connecting, and my father was actively involved in colon cancer listservs. And I took up where he left off when he passed away and getting involved. C3 started because we saw a huge gap in advocacy, particularly research and legislative advocacy. There were a lot of people, Katie Couric being probably the most public voice, telling people to get a colonoscopy, the symptoms of the disease. What was missing was the action on Capitol Hill, was the attention, was the amount of dollars. And we were looking at what the AIDS movement had done. We were looking with pediatric cancers. We were looking at breast and cervical and seeing that it wasn't the pharmaceutical companies making a difference. It wasn't the talking suits. It was the people who have the disease, who are making a difference, who were here on Capitol Hill, who were going into on patient working with the people who are designing clinical trials to really push research forward. Until the last 10 years, advanced colon cancer, if you were diagnosed with it, there was one treatment for it, and if you failed or that treatment failed you, they sent you home to die. And that's pretty much my father's situation. So about 4 of us started really saying, we got to do something, let's start a group. And I am based in New Jersey. The founder of our organization is based in Oregon. And the person who was really driving our research, we had one person in Chicago and one person in upstate New York. And we decided to start an organization based in Washington, D.C., and nobody was going to move here. So we got one little office here up by the Van Ness Metro Station, about the size of Google's Coke Room. And all we had was a laptop and a power outlet, and someone we were paying $30,000 a year to answer the phone and process stuff. So we started with the cloud services. Our infrastructure was based in the cloud. First thing we did with the seed money is we formed a relationship with GetActive, which is now Convio. So our first website was a few static pages, and the rest were static pages out of GetActive. So we were able to start building an email list. We started with our personal contact list of under 2,000 names as our initial list. We went online with GetActive. About 6 months later, we realized that while we had a wonderful way of capturing people online through that initial partnership with GetActive, we were missing that offline component. Started talking about offline databases. That's when we found Salesforce about 6 months later, and that was our now our offline database. And then as we started getting a little bigger and slowly growing, we started having a lot of trouble with spam. That's a huge issue. We were using the ISP email, and when you're a colorectal cancer organization, spam filters are a little hard to figure. And because, you could whitelist your contact list, but people from the outside were writing to us, and no matter what I did, they kept going into our spam filter. And so we started about almost a year and a half ago with Google Apps. So now we have about 16,000 advocates and donors. At this moment, while I'm sitting here talking to you guys, we have 70 advocates on Capitol Hill lobbying for HR 1189, which is the Colorectal Cancer Prevention and Treatment Act, which is a bill that would pilot free colonoscopies for underserved populations. And so we've got 70 people who are wearing Cover Your Butt is our campaign to push for this legislation T-shirts. And it's really powerful because on average, we do this every year. First year, we had 10 people we sent.